Hello, and welcome to the Living Well Show, the program that strives to empower older adults to live life on their own terms. I am your host, Nicolette Hume, the Community Engagement Coordinator for the City of Lake Oswego Adult Community Center. Today, we will be talking about sleep disorders, which also includes insomnia. Today, I would like to introduce our guest, Dr. Jade Wu, who is a board-certified sleep psychologist and researcher at Duke University School of Medicine. She earned her PhD from Boston University and completed her clinical training at Duke. Her current research focuses on treating sleep disorders in those with chronic illness. Dr. Wu is a frequent guest on popular radio and podcast shows like NPR, and her work is featured in publications such as the New York Times, Scientific American, Huffington Post, and many more. She also hosts the award-winning podcast, The Savvy Psychologist. Welcome to the show, Dr. Wu.
Thanks so much for having me, Nicolette.
It is a real pleasure and treat to have someone who, first of all, said that they would agree to come on the show, but all the way from the East Coast. So I appreciate you coming here with a little bit of a time delay. But
Sure.
before we begin, I'd like to ask you more about how you got into your work with sleep psychology.
Yeah, so my story with sleep actually begins way far back to when I was a little kid. My father
Mhm.
actually researched sleep as part of the Chinese equivalent of NASA. So he was part of the Chinese Space Agency, and he was doing research with astronauts to learn about their sleep in spaceflight. So I got introduced
Wow.
to the sleep lab and everything very early on as a 5-year-old. And I thought it was just the coolest thing in the world what my dad was doing. And I vowed to become a sleep researcher. And since then, during your teens, you rebel, you don't want to do what your parents do. But eventually, I made my way back and I became very fascinated by psychology during college. And so I decided to pursue a clinical psychology PhD. And during that time, I decided to focus on behavioral sleep medicine because I really think that sleep is the foundation or the linchpin for so many other aspects of mental and physical health. And when you have good sleep, everything else is just easier and better, and you're more protected from other chronic conditions, and you're more likely to heal from conditions that you do have. And so I just thought sleep is the secret to everything, and I wanted to study more about it.
Well, and the one thing that I want to say as well to our viewers is that you're definitely a primary, or your primary research is within sleep psychology, but you also
Mhm.
write a number of articles on a variety of topics. So definitely Google her. You will find a lot of information. Um, but also, too, within your podcast, you address a lot of different issues as well, everything from sleep to family issues and so on. And so, with that being said, in your private practice, is this something that, you know, you primarily work with just the sleep part, or do you also work in other areas of psychology as well?
Yeah, so I have a background in treating anxiety disorders and depression. I've also trained in a cancer center to provide social support and psychotherapy to people who have been diagnosed with cancer or their family members. And I also worked in a fertility clinic for a year, and I learned a lot there about reproductive mental health. And so I like to wear a lot of different hats, but sleep is my main one, and that's the one I'm most passionate about. And the great thing about sleep is that because it's so related to so many other aspects of our mental health and physical health, I get to dabble in pretty much everything else too. So the for the podcast, I do a very wide variety of topics, like you mentioned, family estrangement, and we also talk about the classics like panic attacks and how to talk to your partner, how to spot a conspiracy theory and why do we believe in them, things like that. Just, quick and dirty tips for better living using psychological science.
And the one thing that I appreciate that in your information, you also sometimes share personal, how it personally has affected you, like let's say panic disorder or those
Hmm.
times of having a panic attack, I should say,
Yes.
and kind of
Hmm.
sharing about your own experiences with it and making certain topics like that that can feel taboo more relatable and people willing to look for solutions within the privacy of their own home on their phone.
Right.
So I
Sure.
definitely appreciate that. The other
Thank
thing I
you.
wanted to, you're welcome. The other thing I
Mm-hmm.
wanted to talk to you about is with the pandemic and
Mm-hmm.
people being at home more than ever, even though things are starting to open back up. Um, our sleep, it seems, has become disrupted.
Yes.
How would you say, or why would you say that is happening? I know for myself, I have found many, many times waking up at like 3 in the morning and just kind of being
Mm.
ready to go and not
Yeah.
really sure why. So, and I know I'm not
Yeah.
alone in that. So, could you tell, us a little bit more why this is happening?
Sure. And you are certainly not alone in this. There's definitely been a spike in sleep issues since the pandemic has started. Some lucky few people are actually having better sleep now than they used to, but I think they may be in the minority. I have at least heard from my colleagues and from my patients and people I talk to that a few main things have changed to disrupt people's sleep. One is that because we are at home all the time and we can work from home, a lot of us, we have a less constrained schedule. So we are more free to wake up whenever we want, go to bed whenever we want. There's basically no separation between work and rest and private time. And so when schedules go out the window, then so does your internal clock. So we have a circadian rhythm or circadian rhythms.
Mm-hmm.
And this is really just an intricate network of clocks in your body and your brain that tells you what time it is. And it really needs a lot of help from us to reset it every day because it can't, we don't literally have a clock in our brain, so we can't tell time without cues like light and meals and socializing, activity levels. So when we do those things at pretty set times during the day, like wake up at the same time every day, go to bed around the same time every day. If you're someone who's in a siesta culture, maybe you take a short nap at the same time every day and you eat your meals at about the same times and you do your social activities and physical activity about the same times. All of these things help to set our clock each day. And the more clearly we can give our internal clocks those signals, the happier our clocks are. And the more they are able to help us be awake during the day and asleep at night. So when your clocks are confused, then you're going to feel draggy during the day, maybe drowsy, not as alert and awake. And at the same time, you won't be as sleepy or able to stay asleep well at night. So just this lack of schedule is a big one. And another thing I've heard a lot about is that people are having more nightmares and more bizarre dreams. And that's actually a timing issue as well. So, most of our dreams happen during rapid eye movement sleep, or REM sleep for short. And most of our REM sleep happens in the morning hours. So, what happens when we are always getting up too early to go to work, for example, in most of our adult lives, many of us who are not extreme morning people, we don't like to wake up at 6 a.m. or 7 a.m. to go to work, but we have to do that. So we're cutting off some of that REM sleep that we would be getting. Now, during the pandemic, because we can suddenly work from home, we suddenly are sleeping in more and we're getting that REM sleep that we didn't used to have before. And so it's almost like REM is coming back with a vengeance and giving us more intense dreams, more bizarre dreams, and that can sometimes lead to more nightmares as well.
Do you think that the nightmares could also be due to some people facing uncertainty in their lives. It could
Yeah.
be, lack of resources, lack of, you know, work or what have you, and that's coming out in our lives or in our dreams, I should say.
Absolutely. I think that's a very good hypothesis. Having these timing changes and these internal clock changes, that's kind of like laying down the kindling so we're ready for more nightmares. And then what lights a spark is the stress, the uncertainty, the grief that many people have experienced, the changes, the major adjustments we've had to make, people with kids having to homeschool while working, while parenting. It's really a lot. We've gone through a collective trauma, and this can certainly show up in our dreams.
Well, I can attest that, yeah, it has definitely thrown, as a mom and who also has a husband who's teaching as well, it's like your
Mm,
life is completely in this space of kind of fluidity. It's like you try to be
yeah.
as, structured as you can, but as adults, I mean, like I was telling you, waking up at 3 or responding to emails at 2 in the morning because I am up and ready to work, or staying up late, and not because
Mhm.
there's a good show on Netflix or anything like that.
Although there's plenty of
But
those too, keeping us up.
that is true. The other thing too with the dreams, I am kind of
Mhm.
curious. Does your field of study kind of go into more of what's some of these things could, like if we had a night terror or something that was really intense, should we,
Mhm.
is a dream just a dream, or could there
Mhm.
be something more symbolic about it? Do you ever go into
Mm.
any of that?
That is a really fascinating question. And I think as the field of psychology has evolved, we've gone a little bit less towards interpreting dreams as symbols for deeper hangups that we might have, for example, and more towards the idea that dreams could reflect our general sense of well-being. So if you're overall stressed and you overall have a sense of uncertainty and you are perhaps anxious or depressed, you may have more nightmares or bizarre dreams or worse dreams, but the actual content of those dreams do not necessarily specifically match up to any symbolic meaning. So for example, you could be forgetting, or in your dream you might think, oh, I didn't take my high school math exam. I never actually finished high school. I need to go take that exam and I didn't study. I think this is a dream that many of us have had, this sense of unpreparedness and being put on the spot and we don't know what we're doing. That doesn't necessarily mean that you are not confident in your math skills or you feel unprepared for life in general. It just might mean that your overall mental and physical state is in a more tense state and you feel more uncertain and you feel more stressed. So I would say, to answer your question, maybe the answer is sort of. Your dreams may very much reflect the types of things that you're thinking about and the types of stressors you're dealing with, but I wouldn't read necessarily too much into the specific occurrences or the specific images.
Okay, that is good to know. I will say I always have this dream that I have a college paper due. Like
Oh,
I
yes.
have forgotten about it. It is due, and oh my gosh, it's going to be late and all that other stuff. So I wonder if
Mhm.
anyone else has that issue. But in regards to sleep issues that people face, what are some of them? And then when does it kind of go into the realm of being diagnosed as a disorder?
Sure. The most common sleep problem, sleep complaint is certainly insomnia. So, insomnia is when you have trouble falling asleep or staying asleep. And it's not only a nighttime problem, it it causes you some problems during the day, whether it's you're more tired, it's harder to concentrate, your mood is worse, or even just that you're worrying a lot about your sleep. And normally we consider it acute insomnia or short-term insomnia if it's less than 3 months or so, and then chronic insomnia if it's more than 3 months in duration. And it's not just a once in a while, like once a week, once every couple of weeks kind of occurrence. For people to be diagnosed with insomnia disorder, most of the time they're having trouble sleeping at least 3 or 4 nights of the week. So usually the folks I see in my clinic are people who have experienced this for months and more often years. And they say that they have tried so many different things. They've tried to shape up their sleep hygiene. They've tried multiple different sleep aids, whether it's over the counter or prescribed. They've maybe gone to therapy to try to ease their anxiety, to see if that would help. And they've tried exercising. So people who have had chronic insomnia for a while have usually put a lot of effort into trying to solve their sleep problems without too much benefit. And that's because the way that we develop chronic insomnia is that we start out with some proneness to insomnia. Perhaps you're a light sleeper, maybe you're more sensitive to noise or light, maybe you're born just a little bit more keyed up and ready to wake up at the slightest noise. And then there's often an event or some sort of stressor in life that kicks off the insomnia in the first place and really takes a hit to your sleep. And that could be, any number of things. That could be moving across the country, starting a new job, losing a job, having a baby, getting a divorce, any number of things that could stress you out or change your sleep pattern and put a wrench in your sleep. But often, most of the time, after this happens, people's sleep go back to baseline, go back to normal. We sort of auto adjust back to a good relationship with sleep again. However, for the people who end up developing chronic insomnia, there are things that keep the insomnia going. These are the things that I like to think of, logs that you keep adding onto the fire. If only you would stop adding logs onto the fire would burn itself out. You would go back to baseline. But sometimes we unwittingly do things that we think are helping our sleep, but are actually keeping the insomnia going. So one example could be that we try to go to bed early every night because we're thinking, oh, my sleep is not good. So I need to give it extra help. I should go to bed extra early to make up for the lost sleep or to make sure that I have plenty of time to sleep. But then what happens is if we don't have enough sleep drive built up, like we're not sleepy enough yet, our bodies are not yet hungry for sleep, and we're going to bed, then we're not going to fall asleep. So then what ends up happening is we toss and turn and we get frustrated with not being able to fall asleep. We maybe get anxious about how, we're not going to function well the next day because we're tossing and turning now. And all of that just adds on to the anxiety, adds on to the performance anxiety, which makes it even harder to sleep. Then it becomes a vicious cycle and we get into a pattern and we end up having this messed up relationship with sleep that makes chronic insomnia possible.
Well, and so it becomes chronic insomnia, and then that becomes the disorder, or what type of disorders kind of play into that, or is just insomnia just one type of sleep disorder?
Insomnia is one type of sleep problem, and insomnia disorder is basically when insomnia becomes long term, when it's been more than 3 months. And you asked about whether other disorders play into it too, and I think that's a really good question because often insomnia co-occurs with other disorders. So it's a little bit of a chicken or egg question. Sometimes it's really obvious. People slip and fall and they end up injuring themselves and they have surgery, and that can certainly disrupt your sleep. And from there on, if we are not returning to baseline, not getting back to a good relationship with sleep, then that can certainly kick off a bout of insomnia that could become chronic and become insomnia disorder. But sometimes it's not so easy to tell what came first. So often depression and insomnia go hand in hand. And it could be that insomnia happened first and people became depressed because they're not sleeping well, because they feel more stressed out, because they're not functioning at their best during the day. Or it could be that someone who was prone to depression already or already had depression, they're not sleeping well because they have depression, or some other factor could come into the mix. The point is that insomnia tends to co-occur with other things like pain, depression, anxiety, other types of chronic health issues, and that's actually the area that I study most. Um, and I think it's very important to treat both that disorder and insomnia, because insomnia doesn't just magically go away once you've treated your depression or your chronic pain. Sometimes, often, insomnia takes on a life of its own and it carries on. It keeps being a problem even if your depression is better or even if your pain is not a problem anymore.
Hmm. That just seems, is it because we have set off our circadian rhythm in like it's just kind of wonky and we've been dealing with it for so long, it's hard to kind of get it readjusted after, let's say, we feel better with, we're depressed, so we start taking antidepressants and we're feeling better or what have you. Is that how that
That's a great
works?
question. Yeah, so circadian rhythms can be certainly part of it. That's a big area that I work with my patients with insomnia is getting them back on a more consistent clock. Because sometimes when you have insomnia, you try sleeping in on weekends or your days off in order to make up for lost sleep. But then what happens is you're just jet lagging yourself. I work in North Carolina, so we're on the East Coast. And sometimes I see that people are getting up at 6 a.m. during the weekday and then getting up at 9 a.m. on weekends. So it's almost like they're flying themselves to Oregon and back, you know, during the week. And they do that every single week. So that's a lot of jet lag to deal with. That can certainly disrupt sleep and keep insomnia going. And there is a lot of other factors too that keep the insomnia going, give it a life of its own. And these are the perpetuating factors of insomnia that I try to identify with my patients to figure out what's keeping that going and how can we take those logs out of the fire so that their sleep can go back to normal.
Well, and you talk about sleep hygiene. And
Hmm.
what does that really mean? And is it
Yeah,
the
so
same for every person?
Yeah, I think that's a brilliant question. Often we think of sleep hygiene as just a set of rules. Everyone has seen this list, right? Usually it includes, not drinking caffeine after a certain hour, not exercising too close to bedtime, or not eating too close to bedtime, darkening the room, keeping the room cool when they sleep, things like that. So the thing about sleep hygiene is that it does not work to cure insomnia. It's like dental hygiene. You obviously want to brush and floss. These are good things to keep your dental health good. But once you already have a cavity, flossing is not going to get rid of that cavity. You need other treatments. And that's the same thing with sleep hygiene too. So it's generally good to follow these guidelines. I mean, you don't need to follow them exactly. Occasionally having coffee, in the evenings is not going to permanently ruin your sleep. And for people who only have time to exercise in the evening, I'd rather them do that than not exercise at all. So I would say sleep hygiene is a little bit more fluid, it's more individual. People have different levels of sensitivity to caffeine, for example. So I think this is more of an individual set of good practices to follow that people can figure out for themselves with some experimentation. However, once someone already has insomnia, sleep hygiene is not going to cure insomnia. In fact, we use sleep hygiene as the control condition in our trials, in our insomnia treatment trials. So it's equivalent to giving a sugar pill to someone. It's the placebo condition, and that's because we know that it doesn't work to cure insomnia. The things that would work to help with insomnia are more things like like I mentioned, getting more consistent with your clock, figuring out what are the other behaviors and ways of thinking about sleep that are getting in the way of having a good relationship with sleep. So, for one example, for how thoughts can interfere with our relationship with sleep is, in the middle of the night, if you're waking up at 3 a.m., like you mentioned before, what's your first thought? Maybe you're thinking, oh shoot, my sleep is ruined for the rest of the night, or oh crap, I'm not going to be able to function well tomorrow, or oh, I really, really, really should go back to sleep. Come on, body, what's wrong with you? Mind, why won't you just shut off? Well, then you start to get into an adversarial relationship with your sleep. You're working really hard to manage it, to try to fit it into a pigeonhole. You're trying to brute force it almost. And that kind of performance anxiety does not help your sleep. So, it's things like this, the way we respond to waking up during the night, the way we respond to not being able to fall asleep, and the way that we give our bodies a chance to build up enough sleep hunger during the day or not, that really will affect whether we generally are able to fall asleep and stay asleep well.
So let's say you wake up at 3 a.m. or earlier. Do you just lay there in bed and do the tossing and turning? Maybe even feel a little resentful of the person next to you who is sleeping so soundly? Or do you get up? Like what should a person do? What should they do and what should they not do?
Hmm. So everything you described there, super common. I've heard people say like, "Oh, I just want to smother my husband because he's snoring away so peacefully and I'm here tossing and turning and it's going on the second hour now that I'm awake and it's just painful, right? It's like torture." So I would say the short answer to your question is don't torture yourself. If you're not sleepy, get out of bed and do something else enjoyable. Like, is there a book that you've been meaning to read, a TV show you've been wanting to catch up on? Do you like to do a coloring book or doodle? Whatever is kind of a low key, enjoyable activity that you can do during the night, go do that instead. Because at the very least, even if doing that is not going to put you back to sleep, at least you're not tossing and turning and torturing yourself in bed. And that torturing yourself in bed, it's not just unpleasant in the moment, it's also teaching your brain to not like your bed in the long run. Because our brains are very, very good at putting two and two together. If we spend a lot of time tossing and turning in bed, being frustrated, being resentful, being anxious, or even if you're just lying there tossing and turning, thinking about some movie you watched or um, singing a song that you can't get out of your head, that's your brain learning that the bed is the place to do those things, to be awake and be frustrated. So next time you get into bed, your brain is like, oh, great, I know what this place is. It's the place where we toss and turn and get frustrated. Okay, let me fire up that program for you right now. I got you. So your brain is trying to anticipate what you want based on what you've already done in the past. So teach your brain what
Mhm.
you actually want, which is to relax and enjoy yourself and have a good time and just feel generally, not in an effortful performance situation, but rather in a relaxing situation.
Well, and I have heard of some individuals getting like this sleep anxiety,
Hmm.
even though they're tired and what have you. It's almost like performance anxiety on some level, to fall asleep. And so for some individuals um, that I have worked with who are older adults,
Hmm.
and again, we are in the state of Oregon, so we have some things that are legal that may not be in states like where you're from. But I have
Hmm.
heard from some individuals that they will use products like a CBD tincture that has a trace amount of THC in it,
Hmm.
or melatonin or things like that, and have sworn by it. I don't know. I have never tried this, but in your field, what have you seen to be helpful in that
Mm.
regards? Or are you even able to share it all?
Well, so I am not a medical doctor, so I do not ever give advice about medications, whether someone should start one or stop one. My doctoral degree is a PhD in clinical psychology, so that's the area in which I work. So I won't say which substances are good or not good for, or I wouldn't say which substances should you take or not take. However, I have a piece of food for thought for people to consider when it comes to taking either over the counter or prescribed medications for insomnia, which is that these medications do not get at the root of why you have insomnia. It is not solving the issue that gave you insomnia in the first place, and it's not solving the issue that is keeping your insomnia going now. So that said, I have known plenty of patients who were perfectly happy to stay on a medication indefinitely and be happy with how it helps them sleep and it didn't seem to affect them in any other way. In that case, by all means, if you and your doctor believe that's a good way to manage insomnia, by all means, there are certainly many cases where that would be the case. And I've also talked to plenty of patients, especially older adults, who really don't want to stay on sleep medications or don't want to take any recreational drugs for sleep because they're worried about potential side effects. Or they're worried about their doctor not prescribing them Ambien anymore because there is a higher risk of things like falls or other neurological side effects potentially from these medications. And there's also the concern of psychological dependence. So when it comes to sleep, there's a really, really powerful psychological effect from taking a pill and then falling asleep because it's such an immediate effect or such a quick effect and an effect that really you build up a little bit of tolerance to so that if you ever want to come off of medications, often people have a really hard time because they spend the next 2, 3, 4, 7 days not sleeping much at all or not sleeping well after they come off of whatever medications they were taking. And then they think, well, I've tried it. It didn't work coming off of this medication. That must mean that I need this to sleep. What they're not thinking about is that when you take any sort of substance out of your system for the first time after a long time of having it, you're going to have a withdrawal effect. So you're going to have some rebound insomnia. This doesn't necessarily mean that you need the substance to sleep. I've worked with plenty of folks who have been on multiple medications for 10 years, 15 years, and we were able to come off of the medication once they've learned the behavioral skills and they've learned to have a different relationship with sleep and they felt confident enough to gradually taper off of their medications. And there are ways to do that gradually that are not or that minimizes the withdrawal effects and maximizes your chances for sustainably coming off of that medication. So for your audience, I think especially for older adults, it can be scary to think of coming off of medications, but it's very doable. And I also very much understand that you're concerned about your doctor maybe not wanting to write that prescription anymore, or you're concerned about side effects. So do talk to your doctor to get a referral to a behavioral sleep medicine specialist to help you taper off of that medication, or at least have a conversation about that.
I think you bring up two really great points, and that is, especially as individuals get older, we are at higher risk for
Mhm.
falls. And a
Yeah.
lot of those falls do take place in the middle of the night when
Mhm.
usually having to use the restroom. And then the other aspect of that psychological conditioning
Mhm.
to certain sleep remedies or ones that we are associating with getting that desired need for sleep, but it possibly, do you think that some of it, like let's say if someone was taking like a herbal supplement or what have you, that there's kind of like a
Mhm.
placebo effect at play with that, or there could be. Um, The other question
It,
too is,
mhm.
oh, go ahead. Go ahead.
Oh, I was just going to say that's possible. It's hard to say without having the full medical history and a conversation with someone one on one to learn the whole context of their life and their relationship with sleep. It's possible that someone is having a placebo effect. But if the substance is pretty benign, if there's not really any side effects and there's some placebo effect, why not? If it doesn't hurt, the only thing I would say is that I think often when our sleep changes with age, we begin to wonder if, our sleep needs help with an herbal remedy or with medications. And often that might just be someone's sleep changing with time. And that's perfectly normal. We know for a fact that sleep does change with time and that this is okay. I know your audience has probably read all sorts of headlines about, oh, you need to get deep sleep, you need to get 8 hours of sleep, you need to sleep, soundly every night without waking up, or else you're going to have dementia. That this
Yeah.
alarmist kind of headline is all over the place. But, we actually know from research that for older adults, it's perfectly normal to sleep as little as 6 hours. Some people sleep even a little bit less, and that could be okay too. It's very individual. The range for what is normal sleep, even within an age range, is quite wide. So the only way to really tell whether you're getting enough sleep is to see if you can sleep some more. If you're not able to sleep more than the 7 hours that you are getting without getting insomnia, without tossing and turning and ending up being frustrated, then you probably are getting enough. At least when it comes to the duration of sleep. Sleep quality is another issue that we can talk about a little bit more if you're interested, and other sleep
Yeah.
disorders that are prevalent in people with in older adults particularly. But I would say go with the flow. It's okay that you're not sleeping the same way that as you were sleeping in your 20s and 30s, and it's okay if you're sleeping a little bit less. Our needs are different when we get older. We're not going through puberty anymore. We're not, doing the same amount of physical labor as we used to. Our bodies are not growing as much or taking on as much physical burden. So it's very normal to sleep less in your older age than before.
What about those times where, or kind of going on that point you just talked about the sleep quality. So let's say you hit the pillow and you're like, man, I am so tired. And you're excited to go to sleep because it looks like it's going to happen real easy. And then you're up early and it's like, what the heck? Why does that happen? Is it a sleep quality issue or something else?
So by up early, do you mean like several hours later in the wee morning hours you're up, or
Yeah,
like you can't fall asleep in
yeah.
the first place? Oh,
No,
okay.
let's
So,
say you
mhm,
go to bed tired, and
mhm,
then you wake up at 2 or 3 in the morning, or something that is an undesired time. So
mhm.
what? Why does that happen?
There could be a couple of things going on there. One is that, wow, actually, there are three things that could be happening there now that I think about it. So, one is that it's possible someone is going to bed very early and then they're getting the sleep that they need by 3 a.m. So if you're an older adult and you're going to bed at 8 or 9 p.m. because you're just so tired by that point, if you're sleeping until 3, you've gotten 6 or 7 hours of sleep. And that's actually a very, very normal amount to be sleeping, even for middle-aged adults. And for older adults, certainly 6 hours could very well be enough. And we do know that as we age, our timing shifts a little bit earlier. We tend to be night owls when we're teenagers and in our 20s, and there's a biological reason for that. Whereas when we get older, our circadian clock shifts a little bit earlier and earlier, so that older folks as you probably know, are probably not pulling all-nighters and not partying into the wee hours, they tend to be tired a little bit earlier and sleepy earlier. And so it might be that someone is just becoming more of a morning lark as they age, and they have gotten enough sleep. Another thing to keep in mind is that it's actually very natural to wake up during the night. There's this myth that we should be sleeping straight through, that we should be sleeping like a dead log, and that means we're having good sleep quality. But actually, healthy sleepers in who are adults can have as many as 16 or 20 awakenings during the night. They just don't remember most of those times, ideally. So, waking up briefly is very normal. It's part of our sleep architecture, or the shape of our sleep. So, we're switching between different stages of sleep and different types of sleep throughout the night. And during those transitions, and sometimes even in the middle of a bout of light sleep, we can wake up briefly and we hopefully roll back and go back to sleep, but sometimes it doesn't happen. And it's very normal to have awakenings long enough that we remember maybe 2 or 3 times a night. So if you're waking up at 2 or 3 a.m. and you're suddenly wide awake and you can't go back to sleep, it may be that you had a normal awakening, but then you started thinking about, oh, shoot, now my sleep is ruined, or oh, now I'm not going to go back to sleep, or there's something stressful going on in your life right now. Or, like I said earlier, our brains are very good at putting two and two together. So if you have spent a lot of time tossing and turning in bed, then your brain is like, oh, we're in bed. I know what to do. Let's start tossing and turning and being frustrated. So that could also be going on. And the third thing I'm thinking of is that, biologically, it may be that we are built to be creatures who sleep in two chunks. Um, and that the evidence for that is, in pre-industrial times in Europe, it was very, very normal for people to get up during the night at about 2 a.m. or 3 a.m. and do an hour's worth of chores or visiting their neighbors. They sing, they pray, they tell stories. It was just a normal thing to do for everybody. And then after that middle of the night awakening fun time, they will go back to bed for their second sleep. And so this shows us that maybe before we came up with this idea that we have to sleep in one solid chunk of 8 hours, there was a time when we followed our natural rhythms and we were up for an hour during the night. And there are still cultures in the world today who get up during the night to pray, or to be intimate, or to do chores. That reflects the possibility that our bodies are built to sleep in that way. So it may be that sleep is a two-person relay race where the first part is mostly driven by our sleep hunger that we've been building up all day just by being awake. And the second half of sleep is driven by our circadian clock telling us, oh, well, even though we've run out of that sleep hunger, that fuel a little bit, we still have time on our hands, and it's still nighttime, and we still need a little bit more sleep, so let's go back to bed. That could be what's going on here.
Well, also too, I've known of some people that feel eating before bed is helpful to them in falling asleep. What do you think about that?
I think a small snack could be great, just to hold you over so you're not hungry during the night, or just for enjoyment's sake. But a big meal probably is not a good idea right before bed, because that keeps your metabolism working hard and keeps your body temperature up. And that's not the greatest condition for sleep. Plus, you might get heartburn, and you know, um, generally it's not good for your metabolism to eat later at night. And for weight management too, if you're eating later at night, you tend to eat more calorie and fat rich foods, and it makes it harder and also at that time your metabolism is not quite as active as during the day, so this makes you more prone to gain weight if you're eating a lot in the evenings.
Oh, absolutely. And then the other question is phones. So people
Mm-hmm.
looking at their phone before bed, kind of maybe even using it as a pacifier, if you will, and figure if they have it on the night mode that maybe that's going to, eliminate the blue light and such. So what is your thoughts about, looking at your phone before bed?
So the light is an issue if there's too much light. If your phone is on its highest brightness setting and you have it right in your face for multiple hours, yeah, that will stimulate your brain certainly, and that will also teach your brain to release melatonin later, which basically is shifting your biological clock to make you more like a night owl. Um, but if there's just some looking at the screen, if the screen, is turned on low and you're not having it right in your face for too long, that's not really going to shift your melatonin profile too much. So on a biological level, it's maybe not too big of a problem to look at your phone. But what I'm thinking of is the content on the phone. So are you looking at
Mm.
really stimulating news items, for example? Are you doom scrolling? Are you looking at your friend's Facebook profile or Instagram profile and feeling really jealous of their life? What are you actually taking in terms of content and stimulation, and that may be more of an effect on your whether or not you can wind yourself down for sleep. And if you think about what is on your
Hmm.
phone, that's, it's your work, it's your calendar, it's your social schedule, it's your social comparison with other people, it's your hangups about your life, it's where, you are calling, that's the device you use to call customer support to argue with them, and you're on hold and you get frustrated. So all of the things that we associate with our phones, do we really want to take those things to bed with us? So that's the thing that I'm more concerned about.
That's a really good point because, yeah, I know that I have looked at my phone before bed and have scrolled onto, like, let's say Facebook and a news feed that I'm like, oh, this is so heart wrenching. I don't want to think about this at this
Yeah.
moment, and how
Hmm.
troubling that can be. And so,
Hmm.
also, too, I know that there's this whole idea that, let's say you had, um, whether it could be with your kid or your spouse or any situation in your life, this whole notion of not going to bed with like unresolved feelings, or what is it, the old adage, don't let the sun go down on your anger or whatever. Do you really think, as a psychologist, that you should hash out these things before bed, or should you just kind of let that, you know, part of our reptilian brain calm down and then go into some of these deeper dives in the morning or next day?
I think you make a very good point about giving ourselves space and time to calm down a little bit, to unwind a little bit. I know this popular saying that you're talking about, like, don't go to bed angry, right? Don't go to bed in the middle of a fight. But I think, with better sleep in your system, with better rest, after you've slept and had time to literally process your emotions, which is one thing that our brains do during sleep, and to repair our bodies from the wear and tear from yesterday, we're just feeling better in the mornings, hopefully, after a good night's sleep. In that kind of mode, in that state, we're much more likely to have an open mind, listen to each other, be kind to each other. We're better at communicating, we're better at thinking, we're better at emotion regulating. So I'd say, if it doesn't seem like it's going to be resolved anytime too soon, you might as well go to bed and get a good night's sleep. I bet your fight will be not as um, on fire the next morning, and you'll be better able to handle it and have a good, productive conversation.
I agree with you. And I've just seen that on, certain things that people will post, or, certain podcasts or what have you, talking about that and in relation to sleep. And I just thought, as a psychologist, I think that that's a good point of view to have, on something that
Mhm.
it affects everybody's life, regardless.
Mhm.
And so before um, we conclude this show, I really want to ask you about sleepwalking and night terrors because
Mhm.
this is certainly something that at times you see making headlines where, let's say, um, a partner who is in deep sleep has,
Mhm.
struck their spouse in a way that is, or bed
Mhm.
partner, um, in a very aggressive way, completely asleep, that it almost seems like, could that even be real? Tell us a little
Mhm.
bit more about this kind of phenomena that happens.
Yeah, so the few things that you named there collectively are known as parasomnias. And parasomnia just means there's something off or something bizarre about about your sleep. So you may have symptoms like sleepwalking, night terrors, which are not the same thing as nightmares. So night terrors, generally there's no dreaming that causes it, that triggers you to feel scared. It's kind of like waking up out of a deep sleep, out of a dead sleep, just feeling really terrified for no reason that you can discern. And the third thing that you mentioned is acting out your dreams, right? Like aggressive behaviors, punching, kicking, that kind of thing. And that's known as REM behavior sleep disorder. So, REM again stands for rapid eye movement sleep because this tends to happen during REM. So, without getting into too much detail about the mechanics of how all of these work, what I can say is that these are quite rare, and sometimes they indicate a another sleep disorder or neurological disorder, but that's quite rare. Sometimes it's just because your sleep schedule is really hectic right now. You don't have a consistent sleep schedule, so your brain is kind of doing coming in and out of sleep stages in a not perfect way. So sometimes you might be straddling two states at once. You might be half asleep, half in rapid eye movement sleep, and half awake. And that's where you might get something like sleep paralysis. This is where you feel like you've woken up, but you can't move your body. And that's because in REM sleep, our bodies are paralyzed so that we don't, well, not totally paralyzed. Our bodies, our major muscle groups are kind of turned off so that we don't act out our dreams and accidentally hurt our bed partner or ourselves. But sometimes we wake up, but not fully, and we're still a little bit in REM, so that our bodies are still turned off, our muscles are still not able to move, but we're conscious. And what you described about accidentally hurting your partner, that's where the function of turning off your muscles is not happening during REM sleep. So you are acting out your dreams and you might be hurting yourself or your partner. So if something like that is happening, the best advice I can give right off the bat is safety first. So whether to sleep separately or to make sure there are no sharp objects around or heavy objects that you might accidentally run into or hurt yourself on. Those are important. Um, and otherwise, I would say talk to your doctor, perhaps talk to a sleep specialist who's a neurologist who can uh, take into consideration any and all of your other symptoms to see if there might be something else going on here. So some disorders that could be happening, narcolepsy, some types of neurological disorders, or sometimes might be due to taking sleep medications. So Ambien, for example, has a side effect perhaps of sleepwalking. Um, and make sure to regularize your sleep schedule and try to minimize recreational drugs and alcohol. These things should help with these more rare types of sleep symptoms.
Well, I do find it to be fascinating. And you do also mention another aspect, and that is it's kind of more relationship based as well as sleeping. So let's say, um, and I've heard of this happening, especially as people getting older, where maybe due to sleep needs, or maybe they have someone who snores incredibly loud or what have you, this kind of sleeping separately, although they are in an intimate relationship, it's it feels like, is that creating or potentially creating more of a division or
Mm.
distance in that relationship? What do you think about that?
I think it's not at all a problem to sleep separately if that helps either partner or both partners to sleep better. I think that in our culture, there's this sense that if you sleep separately from your partner, your spouse, that means there's something wrong with the relationship. But I don't think that has to be true at all. If you are sleeping together, that just means you're unconscious together in the same bed for a few hours a night. And you can still hang out during the day. You can still cuddle at bedtime. You can still be intimate. You can still do all of the excuse me, cuddle is also right, but I meant couple things that strengthen your relationship and that you enjoy about each other. That's You can still do all of these things. You're not actually doing those things when you're unconscious and asleep. So why disrupt your sleep just for the sake of sleeping in the same bed together? I don't think it's a problem at all. In fact, my husband and I sleep separately sometimes. If he's snoring a lot, or if I have postnasal drip and I'm just miserable, or my back hurts and I need a firmer surface, that's very common for us to do, and I don't think there's anything wrong with that. So, for people out there who wish they had permission to sleep separately and feel like there's nothing wrong with their relationship, I give you permission. You can sleep separately. That's okay.
I think that's a really important thing that you mentioned, because like you're saying, it's kind of a cultural thing, and people, if they disclose that, they're always afraid of that kind of stigma related to what may be going on with the relationship, but it's more of a need that they're trying to fulfill, that's, taking
Mm,
care of their health. So I think that was really important you said that. And I appreciate that you have given people their permission to do so, and they don't have to be
mm,
so worried about what that may mean, or maybe they're wanting to share that with their partner as a desired need, and have been afraid to do so. So thank you for sharing that with our people. And
of
as we kind of
course.
come to a close here, what is the most important information that you would want all of our viewers to take home with them, in general, like the main tips you'd really want people um, to value?
Sure. And if you don't mind, I would love to share two things that I think are super important for everybody when it comes to sleep health. One is your best shot at regulating your own sleep and having good quality sleep is actually to get up at about the same time every day and to get plenty of sunlight during the day. I know you're in Oregon, so it's probably not sunny all the time, but even an overcast day is actually a lot brighter when you're outside than when you're inside.
Mm-hmm.
And getting lots of light during the day is super important for regulating your circadian clock, your internal clock, and it's good for your mood. It gets you outside, it gets you moving. So just going outside for a walk every day, I think, is hugely beneficial and very important, and a habit that everybody should be in, especially for older adults whose internal clocks tend to lose a little bit of the strength that it has for telling when it's day and when it's night. So the more clear signal that you can give your brain that it's daytime by being out in the sun and uh, being active, that's going to be really helpful for your brain and for your sleep. And the other thing I really want everyone to be very cognizant of is to screen yourself for sleep apnea. So by the time someone is in their 60s, even in their 50s, their chances of having sleep apnea is actually quite high. In some studies, the prevalence rates are close to 50%, especially for males. So, especially if you're a man who is in middle age or retirement age, and especially if you snore, and especially if you're sleepy during the day, as in you could lie down on the couch, at 1 p.m. and fall asleep, or sometimes you might even be dozing off in front of the TV or while driving. If you're sleepy during the day, that's a big sign that you should check yourself for sleep apnea. So talk to your primary care doctor. They have some quick screeners to ask you some questions to see if you're at risk. And the reason it's so important to catch and treat sleep apnea is that it's incredibly important for your heart health and for your brain health. Because what happens in sleep apnea is that your airway gets blocked while you're sleeping, and that causes your oxygen levels to go down, which tells your brain, "Oh shoot, there's no oxygen, so we need to we need to wake up to breathe." And when you have sleep apnea, you can be doing this multiple times an hour. So if you have moderate sleep apnea, for example, you are waking up 15 times or more, or if you have severe sleep apnea, 30 times or more per hour just to breathe. So if you think about that, that's, every 2 minutes, every 4 minutes, your sleep is interrupted for you to wake up and breathe. And you're not going to remember this the next morning, but you'll feel it by feeling like you did not get good quality sleep. And you'll feel it in terms of being very drowsy and sleepy during the day. And this, over time, is a lot of burden on your heart to pump blood, because your oxygen is desaturating all the time during sleep, and it's really hard on your brain because your brain is not getting enough oxygen. So I would say the most prevalent and most important sleep disorder to treat in older age is sleep apnea.
You bring up two really, really great points, and certainly one of them is life saving for a number of people. And I just really appreciate that. And I really appreciate you being on our show today. You've given us so much information, and I thank you for your generosity.
Thank you so much for having me. This was a really fun conversation, and I really hope that what we talked about can help your listeners, your viewers, to be in a good relationship with their sleep, to take their sleep seriously, but also be willing to go with the flow, to like their sleep, love their sleep as a friend, and give it the attention that it needs, and to really make sure that they keep up their sleep health into their old age.
Thank you for that. And thank you, all of you, for being with us today. I am your host, Nicolette Hume. Thank you again for being a part of our community. And until next time, always be kind, stay safe, and always stay curious. Take care.